Having a child is one of the most life-transforming events in anyone's life, and to be reassured that the pregnancy is going well does a lot to alleviate any anxiety that the couple may have about the actual birth. And for the past 30 years, our guest tonight, Lance Dursi, has been reassuring couples through the process of ultrasound that their pregnancy is going very well. And if something is not quite right, he tells them how it can be adjusted. So tonight, Lance is going to tell us what ultrasound is and what he does in his office. So Lance, welcome to the show.
Yeah, thank you very much, Mel. Pleasure to be here.
Yeah, Lance, what is ultrasound?
Ultrasound is the use of sound waves, ultrasonic waves, to look at images within the body. And it's fairly simple examination. It doesn't require much time and no pain for the patient, and we get immediate information.
Mm-hmm. And when did ultrasound first start?
Easy for me to remember that. The same year I came out, 1958.
Really?
Yes. Interesting coincidence that I have that as a career now.
Uh-huh. How did you become interested in it?
Well, I started out doing radiology first. And medical imaging is all fairly similar. And back when I was training, all the medical imaging was done within the X-ray department, whether it was ultrasound, MRI, CT, any of those modalities. And so people would go, they'd take X-ray training, and they would learn through the department the different specialization and different specialties like ultrasound. So after I finished X-ray training, I had an opportunity to learn the ultrasound in a lab that specialized in high-risk pregnancy.
Right. Now, doctors also perform this service, don't they?
Yes, they do.
But what you offer is more comprehensive, I think?
Well, I would be careful saying that because, right. I mean, the doctors are, depending on who does it, the quality is going to vary. One of the things that my patients really enjoy is the fact that we're not rushed. And we don't just strictly do the medical part because that can be fairly dry, very much like getting your foot x-rayed, and sometimes it's treated that way. Lay still, we'll get the picture, we'll share the results with your doctor, we'll see you later. In my office, I strive to spend more time with the patient so they can have a better appreciation of what's going on. And, take a little bit extra time to wait for the baby to pose and get nice pictures. And in a regular imaging center, it's not time or cost effective to do that.
Right. How long does a session with you last?
I usually schedule for a singleton pregnancy of 30 minutes because that gives time to do the medical portion if the patient decides they want to do the medical portion of the exam, or if we're doing the three-dimensional portion only, sometimes the babies don't pose right away. And the 3D ultrasound is very position dependent. And you can't pose your subject. That makes it difficult sometimes.
Right. So if the baby, let's say, is facing toward the mother's spine, then can you coax the baby to turn around?
We do some different tricks. I mean, I encourage my patients to have at least some juice before the scan to give the baby some energy. And so at least we have a baby that's moving around. It doesn't ensure that they move where we need them to, but at least if they're moving, we have kind of renewed opportunities during the course of the scan.
Right. Is this a difficult skill to learn? What kind of training do you go through? Well,
it's probably just like learning anything. It's just having a foundation and then having the repetition and good guidance.
The mothers must feel some anxiety when they first come to you, not knowing what to expect?
Sometimes. Yeah, especially, sometimes when I see patients, they're directed to me because clinically a question comes up about the health of the pregnancy. So the patient's anxiety level is high because when they come in, they don't know if the outcome is going to be good or not. And so as rapidly as I can, if there was a question of, the patient comes in because the doctor couldn't hear the heartbeat early on. And so, and there's usually, benign reasons for that, not the one that we jump to. But of course the patient's anxiety level is going to be through the ceiling.
Sure.
So as soon as I get them on the table, I get that heartbeat as quick as I can on the screen. I go, see, there's the baby's heart. So, they relax right away and they can enjoy the scan and feel reassured.
But there must be instances when you don't hear the baby's heart.
Those are unfortunate times.
Yeah. What percentage of cases would that be?
Well, fortunately, a small percentage. I mean, the most common bad news is an early loss of pregnancy. And it's fairly common. It happens to like 1 in 5 of all pregnancies. So it's a real common event. But it's, it's sad every time. So, you make sure when you do encounter that the patient knows that, that it's unlikely anything that they did or didn't do caused that. It's kind of what I call, Mother Nature's, error factor, how often she makes a mistake.
Yeah, how do you break the news to them?
Delicately. You want to kind of prepare them, as far as letting them know that something doesn't quite look right, even if I know already what's going on. So at least it kind of warms them up to the idea that, this is something that might not be a happy occasion. We might have some bad news, rather than just delivering the bad news to them.
Do they sometimes need counseling afterward, or?
Well, I give they go back to their doctor.
Yeah.
And because I'm a sonographer, I'm not a physician, I can't prescribe or give a treatment plan or direct them in any way, medically, legally. So, I let them know what I see, then I give the information to the doctor, they go back to the doctor, and the doctor, who knows a lot more about them than I do, and has the license to direct them, decides what to do with this patient.
Right. So what kinds of things might a mother see on a sonogram?
It depends on when you look. When we look very, very early, say maybe in the first 5 or 6 weeks of pregnancy, I always refer to it as kind of the grain of rice. It looks like a pulsing grain of rice. And those early scans we have to do internally because the baby's so small that you can't see them using the normal full bladder, lotion on the belly approach. So we have to do a vaginal ultrasound. We could see the pregnancy about 2 weeks earlier using that approach because of the proximity. The transducer that we use, the ultrasound camera, is very close, and so we can see things earlier and more clearly.
Right. But as the baby gets older, what things can you see?
Amazing detail. As far as checking the anatomy of the baby, we can, check out structures within the brain. We could look at the chambers of the heart, the walls of the heart. The people that do specialized ultrasound of hearts can do a fetal echocardiogram, and that's where they're actually looking at all the blood flow in and out of the heart, the muscles and the veins that are feeding the muscle of the heart and so forth. So they can look for really, really small detailed defects and so forth.
Right. But you can tell the sex of the baby. You can tell if the position of the baby. I understand that's something called a breech position. Correct.
Yeah, position's a pretty simple thing. Wherever you place the probe, you know what part of the baby is directly under the probe.
Right.
So usually when I start a scan, I usually start at the bottom.
Of the abdomen here?
Exactly.
Yeah.
Lotion the belly, and start at the bottom. And when you do lots of these scans, you'll see, you could know in one view the entire position of the baby.
Sure.
So if you look at the bottom and you see the baby's head, you could tell by looking at the brain which direction the baby's facing, so you know where the spine is. It's going to be on the opposite side.
Sure.
So in a moment, you'll know the complete layout.
Okay, well, you've described this very well, but let's actually see what a visit to your office is like.
Okay,
and
great.
then you can comment on what you see so that people can get an idea of what we're really looking at. So could we please see that shot that I took a few days ago?
This is my exam room, and I have some nice photographs that one of my patients, who's also a photographer, took for me. There's the exam room.
Yeah, what are you doing?
I'm applying a coupling gel. We just call it scan gel, but it's a coupling gel, and that allows the sound waves to penetrate the skin. Without the coupling gel, we wouldn't be able to see the baby underneath the skin. The ultrasound doesn't transmit well through air, so you have to eliminate the air between the transducer and the skin.
Now, what is this device that you're using?
That's the transducer. That's the ultrasound camera, or ultrasound probe.
How can you see the baby's features so clearly?
Well, the equipment has gotten, quite a bit better, and so we have more flexibility in instrumentation. We can focus the machine more effectively. Like right now, you can see I'm preparing to do a 3D image of the baby's face, and this is like half of the face here. You see the baby's nose where the arrow is, and the right side of the picture is the baby's face, and the hand is kind of obscuring the other half. Now I'm rotating the image to the side to a profile facing left, and you can see the baby's nose clearly here, showing the hand.
Drop that arm.
I'm rotating it back towards us, and you can see how the hand is obscuring the image again. So that's another example of how position really affects the image. With the hand there, we're seeing just half of the face. Now here's a really nice view of the 4 chambers of the heart, and I always describe that as a flapping bird. And right here I'm doing a tracing of the baby's heartbeat, and from that tracing I can measure the rates per minute, and also visually and audibly be able to tell regular versus irregular heartbeats.
And there's the baby's face again.
Yep, that's a really cute one. The hand is in front of the mouth as the arrow is pointing out.
Why is the hand so often in front of the face?
The babies, even in the womb, are very oral, just like babies outside the womb. Everything in the mouth, you know. And so it's one of those things that happens in the womb, and it's all really nursing calisthenics. Any suckling they do inside makes the muscles in their mouth and all that stronger, so they're better feeders usually.
Here's the mother's firstborn looking at his brother. Yeah.
Still covering up the mouth. Loves that hand up by the mouth.
Right.
Still that nose.
Yeah.
That's the same nose.
Yeah, look at the nose.
Oh, there. Now the hand moved. Now you see the mouth now.
Yeah.
See, the hand dropped.
Now look at the nose, and then we're going to cut to the brother. He has the same nose.
You can really tell they're related, can't you?
Yeah. That's amazing.
The nose peeking out.
Of course, the child is completely oblivious to this.
They're more interested in my exam table. They like those knobs for the stirrups, you know. I have to always tighten them down because otherwise they unscrew them and they fall on the floor.
Yeah.
Cute. Those babies. I got the baby tipped back there, so the chin is pointing at us. We've just seen the lips
covering the face.
and the hand over the
Similar
face.
view. It wasn't until we got about to here when we're getting the shots where you could see the mouth, cheek, nose. After the baby dropped the arm, the disc here, so you get the video on the CD, and the profile are the forward shots where he wasn't blocking his face. Yeah, those are nice. So all those are on your disk, so you'll be able to make all those you want and email them off. Okay, good. Very good. Neat. Well, thank you so much.
No problem. Thank you, Lance.
Very good. And I'll fire this off to Lonnie so she knows all the good stuff. You gonna hold this? You gonna be the helper?
Say thank
There
you.
you go.
Can you say thank you?
Say thank you.
Hi, my name is Marina. We come to Lance quite frequently to get our ultrasounds. Usually he just does the regular checkups, make sure the baby's growing fine, that there's no problems, which could usually be cut early on an ultrasound. And yeah.
How does this make you feel when you see the baby?
At first it's nervous coming in here just because you kind of don't know what to expect. But, you know, when you get the good news, it's just amazing. And seeing his little face, especially how clear it is.
Yeah. What do you do with the pictures?
We take them home and put them in an envelope and stash them with the rest of them.
Okay, thank you so much.
Sure, thank you. Say bye. You're so cute.
Hello, my name is Christina Hagan. I'm an office manager at KMVT in Mountain View, and I wanted to talk a little bit about Lance Dursi. I went to see him with both of my children. As a first-time mom, I was very interested in getting a 3D ultrasound, and I went on Yelp, and he had some wonderful reviews, and I figured I'd give him a call, and we'd go check him out. And he did not disappoint. He was wonderful. We went in, he put us right at ease. This was one of the pictures I got with my daughter. She's 3.5, and as you can see, the picture is really amazing because she came out looking exactly like I thought she would. And he gave us a ton of pictures, gave us a CD, taped the whole thing. We were very fortunate with my daughter that she cooperated and she gave us a lot of good frontal shots. Here's another one that we got of her as well. When we went for my son, which he'll be almost a year, we were not as lucky. he had his hands covering his face most of the time. And Dr. Lance was very nice. He even said that we could come back at a later time and he would redo the ultrasound, hoping that we could get some better shots. And I didn't end up going back because I thought the shots I got were fine. But he was very nice to offer that.
What was the pregnancy like?
Both pregnancies were great. No morning sickness. My first pregnancy, I was a week late, and I ended up having to have a C-section. And then with my second pregnancy, my doctor believes once you've had a C-section, then you have another C-section.
What was the C-section like? Were you conscious when it happened?
I was. It wasn't an emergency, so I was fully awake. They took me into the operating room, gave me a spinal, and my daughter was here about 30 minutes later.
So Lance reassured you that your baby was okay?
Great, yes. Most women obviously will go to their own doctor to get testing and to make sure the anatomy and everything is fine, but Dr. Lance goes over that as well. The first half of the ultrasound is usually going over all the anatomy, making sure everything looks good, and then the second half is just trying to get good pictures of your baby, trying to get the best pictures, you know, making sure it really is a boy and that kind of thing.
Yeah, Christina, I understand you have a picture of yourself right after the C-section?
Oh yeah, so this was with my daughter, and this was taken in the operating room. And yeah, we just, both times were just really wonderful. We've had two really, really good, good births.
Okay, Christina, thank you so much for sharing your experience.
Oh, thanks, Mel.
Well, Lance, you certainly put the mothers to ease in that video. What do you experience when you're doing this?
I experienced their shared joy because it's a really kind of a nice gift to be able to put people to ease when they're anxious. And especially now, people want to educate themselves. They go online and they want to find out everything about pregnancies. And sometimes that works against them because they learn too much. They learn about all the things that could go wrong, so their repertoire of nightmares is expanded, you know? So it's very reassuring for them to come in and actually see the baby.
Yeah. What I got, I filmed that, and what I got out of it, I was, you know, just amazed that the process of life is, how can we say it? One, miraculous, and two, as automatic as it is. I mean, the baby just happens and comes from essentially almost nothing. I mean, do you have kind of a miraculous view of life now?
I do. And actually, you know, when you study your biology, you realize a lot of things have to happen exactly right to have that all turn out.
Does it amaze you that those things that have to turn out right do turn out right?
Yes.
Almost all the time?
Yeah. It's a very, very incredible design, definitely.
Yeah. Now, right here, we have what? We have babies at different stages of development. And it's going to be a little bit difficult for the camera to pick up these because the first two are rather small. But let me tilt this one forward. And what is this?
This is a pregnancy at 1 month. And this is to scale. So you can see, you know, how small that is. We see the uterus, we see the ovaries, and the baby is little tiny, looks like a little Cheetos cheese puff right there in the middle.
Yeah.
And it's very, very tiny, but we can see a heartbeat. We can already tell which end is which.
So you can see something on a sonogram.
Correct.
Yeah. And do many people come in at this stage?
Yeah, especially if people maybe had a previous loss, or there was a question of a tubal pregnancy. We want to know that the pregnancy is in the uterus as early as possible.
Sure. Now here's at something at 2 months. Okay, and you can tell what at this stage?
At this point, you can already see some rudimentary limbs. I know, once again, I don't know what the camera's going to pick up here, but you see little leg, arm, head. You see some facial features, like a little nose there.
Right.
You know, we can see, of course, the heart. We can't see the chambers of the heart in detail yet. So as far as, you know, checking for abnormalities, too early for that.
And here?
Well, we're already at 3 months, and you see the baby's very developed at this point, and we can, it's at this point in pregnancy they do a screening test called an NT. It's one of the early genetic screening tests that we do, which is pretty amazing. It uses the ultrasound to measure the fluid space behind the baby's neck, and with a blood test they can determine if the patient's at risk for genetic defects without any invasive testing.
Now this is called the first trimester, right here?
That's correct.
Yeah. So is there such a thing as an optimum time for a woman to come in and get a sonogram?
A good catch-all time is probably 16 to 18 weeks. And the reason I say that is that it's early enough where we can still accurately date the pregnancy, determine how old the pregnancy is, because the further along somebody is, the babies are more varied in size, so we can't depend on the measurements as much to tell us about the age. So the earlier we look, the more accurate in dating we look. And if you look very early, when the dating is most accurate, the trade-off is can't tell much about the anatomy. So if we look 16, 18 weeks, we can really do a detailed anatomy survey, and yet we can still tell that the baby's dates are correct and the due date's correct and so forth.
When I was also at your office, one woman there, it was hard to get the baby to turn around properly, and there are some techniques that you can use, hopefully, to get the baby to turn around. And I would like to show one shot where you had a woman kind of going up and down on a table, hopefully to get the baby to turn around. So can we see that, and you can tell us what we're watching?
Okay, certainly.
Just let it free fall.
What we have the patient doing here is she's lifting her pelvis off the table and then just letting it kind of drop. And the whole idea is just to kind of get the uterus to shake a little bit and kind of almost like wake the baby up. Very much like getting a nudge in the night. And so this baby wasn't either moving or not moving where we needed the baby to, so we wanted to stimulate more activity. And this is one of the methods we use to do that. And it's pretty successful. We also try rolling the patient. Sometimes I actually will kind of massage the baby. I'll use my hand to rub the baby to see if I can stimulate the baby to move. And even after everything, sometimes we're not successful. The baby has to cooperate with us to get good 3D pictures.
Is that hard on the baby to have the mother go up and down and thump like that?
Not at all. Not at all. When people comment like that, I say, what do babies like? They like to be bounced. And we're not jarring the baby, we're just bouncing the baby.
Right.
Yeah. Turned the back of his head over here.
Let's see, still didn't get a really good shot. I got the ear and so forth in that picture.
Yeah.
Feel it moving? His ear. His ear. His ear right there.
I've also seen you ask a woman to drink more water. What good does that do?
Sometimes I have patients say that when they drink cold water, the babies become active. And I don't know exactly why that happens. I don't think the baby can feel the water, but I trust the mother. She says, I drink cold water, the baby moves. I'm ready to try anything reasonable to get the baby to move during their visit, because we have a finite period of time to try to get these images.
Now, you work in conjunction with the Long Marine Center in Santa Cruz?
I have done some projects with them. I haven't worked with them recently, but have done some interesting projects where we were scanning sea lions and dolphins and
for what?
Elephant seals. Well, initially I came to them because they had an elephant seal, and they suspected that the elephant seal had kidney stones. And so they asked me to come and look at this animal. And the animals they have there, thankfully, are trained. So it's not like, they have to sedate them and stuff like that. We did that with some other animals that weren't trained. But Sadie was really a gem. She'd just climb out for me, and she'd lay on her side, and she'd pose wherever we needed her to look at her kidneys, and she did indeed have kidney stones.
Yeah, elephant seals can be enormous.
She was a petite 1,000-pound female. That's the males are like 1,500.
Yeah. So your sessions are about 30 minutes. And then if you can't get the images that you'd like, then they can come back for another session? Correct.
Yeah, the only fee for that is just for re-videoing. So $20 they come back. We have another 30 minutes to try to get pictures because, my goal is the same as theirs. I want to get great pictures for them.
Yeah, I've been using the words ultrasound and sonogram. What are the differences?
Well, ultrasound is a broad term that means any sound that's beyond human audible hearing. So a dog whistle would be ultrasound. Sonogram is more specific because it means you're making a recording, the word gram, with sound, sono.
Well, how do you report your findings to doctors? How do you work with them?
Well, some doctors actually refer patients to me. Other doctors will receive reports from me from patients that elect to have the scan because they want the peace of mind to have the measurements taken, even if clinically everything is fine. And that's what the doctor usually goes by, is they have to have some clinical question raised to do a scan once you've done the initial scans, the genetic screening scan and the initial anatomy scan. Patients, especially if they had trouble pregnancies in the past, they would see the baby every day if they had the option. Right. So because the insurance won't cover it unless the doctor orders it, they just pay out of pocket and come and see me.
Lance, we've seen how your service can put mothers at ease, and they've built up a relationship with their child for the first time, and you've experienced the joy that comes out of this. But how has seeing life in such intimate detail changed your life?
Well, you have a better appreciation of what's going on. I mean, life, it's how fragile it is, and how magic it is, to see new life develop from, like I said, the puffed rice. Right. The graduation, I always say, puffed rice or grain of rice, puffed rice, prawn, and then baby. That's kind of it's kind of the non-scientific progression. But that all happens very rapidly. I mean, as you could see from the models, by the time we're at 12 weeks, I mean, there's no question, which way the baby is and the anatomical parts and so forth. So very interesting, very magical.
Right. I've heard mothers say that when they're in a certain stage of pregnancy, they can actually communicate with their child through their dreams, or they feel that their child is communicating with them through their dreams, or the consciousness of the child is melding with the mother's. Have you any insight into this?
Not really. I mean, I hear things like that, and I hear people, especially if they don't know the gender of the baby yet, they'll be getting signals. I'll tell them the sex. Oh, I was dreaming I was having that sex baby, as if the baby was signaling them that I'm a boy or I'm a girl. Right.
How does that turn out? Are they able to predict?
There's not a pattern. It's fun though. It's in the wives' tale realm. So people have fun with wives' tale still.
But it's an interesting concept.
Definitely.
Okay, Lance, we've only had 28 minutes for this, and we've covered a lot, and there's a lot more that we can cover and that I'd like to cover, but we've come to the end of the program, so I'd like to thank you so much for sharing your joy with us and how you put people at ease so that this new life can begin in a really positive way.
Yeah, very good. Well, thank you very much for having me.
Okay. Thank you, Lance.
Okay, thank you.
Yeah.